Dr. Anupam Sibal, we invite you on the stage. He's the co-chair, FICCI Health Services Committee and Group Medical Director, Apollo Hospitals. We also welcome on days Ms. L.S. Changson, Additional Secretary, Ministry of Health and Family Welfare, Government of India. We welcome you, ma'am. We have with us Professor N.K. Ganguly, former DG, ICMR, Chairperson, Department of Biotechnology and Research, Sri Sar Ganga Ram Hospital and President, Apollo Hospitals Educational and Research Foundation. We have with us Dr. Taruna Madan, Scientist G and Head Development Research Division, ICMR, Government of India. We welcome you, ma'am. We have Mr. Gautam Khanna, CEO, PD Hinduja Hospital and MRC. Welcome. And Mr. Varun Khanna, MD, Quality Care India Limited, Care, KIMS and Evercare. Can we extend a warm welcome to all of them, please? Thank you so much. And I request Sri Arun Sibal to kindly hand over a green certificate to ma'am, Ms. L.S. Changson. And now I pass on the baton to Dr. Anupam Sibal, sir.
Good morning, colleagues. Let's get started with this panel discussion. As we all know that India will overtake Germany and Japan and become the third largest economy by 27, and we would hope to be a 5 trillion economy by 2047. But history is replete with examples that for a strong economy you need a healthy workforce, you need a healthy nation, and a healthy workforce in itself could boost productivity by 30% and perhaps could even contribute $3 trillion by 2030. We have a great advantage in terms of the demographic dividend that we enjoy, and the fact that the old age dependency ratio is only 11%, the lowest among the largest economies in the world, places us at a unique advantage. But it's extremely important that while we have these trends, to recognize that non-communicable diseases are creating a very serious problem and in fact are responsible for 60% of the deaths, and we are also seeing non-communicable diseases strike at a much younger age. So as we try and build a healthier nation, non-communicable diseases are an area we need to address. Another area that we need to address is the research output. While we made significant progress in India, and we have the third highest number of scientific publications overall coming out of India and the fourth largest PhD scholars, there is much more that can be done, and that is an area I think we need to focus on. And while we look at the Heal in India and Heal by India programs, there are opportunities for the private and the public sector to come together to address some of the opportunities of working together to really strengthen India's unique positioning to emerge as the hub for global medical value travel. To discuss some of these issues as part of our theme of Swasth Bharat, Viksit Bharat, we have a stellar panel, and it's a privilege for me to introduce our panelists. We have Professor N.K. Ganguly. Professor Ganguly has been director of PGI, president of JIPMER, was the Director General of the Indian Council for Medical Research, is a professor of eminence at the Translational Health Institute, president of the Hospital and Research Foundation, has more than 770 publications in high-impact journals, and someone who can address some of the opportunities that lie before us. So very warm welcome to Professor Ganguly. We have the privilege of having Ms. L.S. Changson with us today. She's the Additional Secretary, Ministry of Health and Family Welfare, Government of India. She's very well recognized for her experience in public administration and her role in implementing strategic policies. She has a very rich portfolio in the ministry, and currently is responsible for public health initiatives, which of course are critical to becoming a Swasth Bharat. Thank you very much, ma'am, for finding time for us. We have with us Dr. Taruna Madan, who is Head Division of Development Research, Indian Council of Medical Research. She has served as the president of the Indian Immunology Society, has more than 100 publications, 5,000 citations, and a very impressive H index of 35 and 8 patents to her name. Thank you so much, Dr. Madan, for joining us. And then have two very senior colleagues from the private sector. Mr. Gautam Khanna, who has more than 3 decades of experience in healthcare, led 3M for India and Asia, and now serves as the CEO of the PD Hinduja Hospital and Medical Research Center in Mumbai, and has played a stellar role in the progress that the FICCI Healthcare Committee has made over the years. Warm welcome, Gautam. And then delighted to have Varun here, Varun Khanna, who's just moved back to India after working in Indonesia and has, again, very diverse experience of working in healthcare across sectors, in the industry, manufacturing, and of course, of late in healthcare operations. And he's currently the Managing Director of Quality Care India. And this entity now encompasses Care, KIMS, and Evercare. So thank you so much, Varun, for joining us. The way we want to run this panel is to have our eminent panelists give us their opening remarks. And after that, we'll have some time for questions. And then, of course, an interactive session with an open house with the audience. So may I request Professor Ganguly really to start with his remarks. Thank you.
Thank you, Dr. Sebbal, for this opportunity. And as Dr. Sebbal was emphasizing on this session is on the non-communicable disease and chronic disease alleviation. I was very fortunate to put this in the UN agenda. I had accompanied Mr. Ghulam Nabi Azad, then Health Minister. I was not in ICMR then, but he took me with him to New York. And we were able to put a vote for this to be adopted in the UN. And after that, we never looked back and we moved along. And one of the things which it was not in that NCD charter, which India put that on the roll, was the mental health. Mental health was not put in the NCDs, but India advocated it very strongly, and mental health was later on included into this. So India actually is challenged for NCD. We are diabetic capital of the world. We have more coronary arteries, more stroke, more asthma, almost everything. You just name it, and we are world #1 in this. And it starts from the childhood. The time we are in the mother's womb, it starts from there, and then it progresses as we grow old, and it is eminently preventable. So I think my first question on this, so I will close on this, and when I'm asked this question, I will tell that what were the Indian initiatives, and what are the new things which have come up where we can get rid of this particular malay from the India. Thank you.
Ms. Langson, for your comments.
Thank you very much, and good morning, good afternoon to all. Dr. Anupam Sibal and my esteemed co-panelists and all the members, the delegates in this FICCI's annual health conference, FICCI Heal, Swasth Bharat, Viksit Bharat. It's wonderful to be here with you all on this occasion. And I'm particularly taken with the theme, Viksit, Swasth Bharat, Viksit Bharat. Indeed, in India, this is Viksit Bharat has been our resounding theme, and we all know that by 2047, we all look forward to call ourselves a Viksit Bharat. And to that extent, so the government in the Ministry of Health and Family Welfare over the years has been taken a number of initiatives. I would like to touch upon some of them just in a brief opening remarks. And to state that to begin with, firstly, it's the budget outlay for any government program. We start with that. And this year in 2024-25, we have seen an increase of 13% over the previous year. We stand at 91,000 crores. And indeed, education, public health, social welfare, these are some of the schemes for which government is primarily responsible, the central and the state governments, but of course, with strong collaboration and in partnership with the private sector. So it's really the right audience that we have here today. You must have heard of flagship initiatives like the National Health Mission, the Pradhan Mantri Ayushman Bharat, Jan Arogya Yojana, PMJY. So under this PMJY, this is the world's largest health assurance scheme. And many of you would have heard about it, at how it has transformed lives since 2018 when it was launched. And in this, a cover of 5 lakhs is given to all the lowest, the 40% of the India's population who are less well off. And through this, we have been able to serve lakhs of families, and we have given more than 35 crore Ayushman cards, which serves the family, and over 7.7 crore hospital admissions have been made, and overall a saving of over 1.26 lakh crores has accrued by way of saving on out-of-pocket expenditure to the families who would have otherwise spent this much. And believe me, I think you all would agree, 5 lakhs for a poor family for any life-saving medical intervention is totally a big boon and a big lifesaver. And this has been taken forward recently too, with the coverage of the senior citizens of 70 years plus. And the Honorable Prime Minister has just launched this on 29th of October and rolled out as a national program. And we look forward to benefiting more than around 6 crore individual senior citizens in the country. This is, it's indeed one of the greatest health assurance coverages, and India is proud to have taken up this. Also, on the digital front, the Ayushman Bharat Digital Mission is another initiative in which the unique Abha ID, Ayushman Bharat health accounts are created. We have created over 55 crore IDs in this, and we are in touch and trying to popularize these, because ultimately the aim is that we would have a healthcare interface, and every citizen would be able to use this, just like the way that we are so familiar in using the UPI interface now. So healthcare also should be at your fingertips in the digital mode, that once we are able to link electronic health records, these would be available to the individual and to the hospital, wherever a person is, irrespective of where their treatment is taking place. So, and across institutions, across hospitals, we look forward to increasing this arc of coverage and take this digital mission forward. We would be having the health professionals registry, the health facilities registries, So we would have one secure database, all this information, so that linking of records would be possible. Under the National Health Mission, the Ayushman Bharat Health and Wellness Centers, now called the Ayushman Arogya Mandir, have been set up. Over 1.7 lakh such health and wellness centers are operational at the primary level. What I just spoke about was treatment at the tertiary level, secondary level, but we understand that universal health coverage would begin with the primary level. It's so important that we improve our infrastructure and healthcare delivery at the primary level. And these bodies are expected to, and they have been consistently delivering the basic essential medical services, even at the sub-center level, through our workforce there, with the at the very grassroots level, the ASHA workers, and then the ANMs, and the community health officers. These are new HR that have been brought in to cater to the health requirements at the primary level. Teleconsultations, taking forward the digital aspect. So e-Sanjeevani, where we have had over 30 crore patients who could be benefited through teleconsultation in remote areas with experts at the different hubs all across the country. In medical education too, you would be aware that we have doubled our seats. I think we'll be talking more about that. New aims, 22 new aims have come up, and that way our medical education seats, and we are producing the HR that's required so badly in this country. It's taken up. And even talking about nursing, 1.5 lakh nursing and paramedical professionals also have been trained additionally. And as Dr. Ganguly said, mental health is also another area, not just because here is again another huge gap in mental health care. So the on a teleconsultation mode, in a telephonic mode, the telemanas has been set up, and counselors, trained counselors are there, and we have been able to provide a fair amount of mental health care services to the public in this regard. So the government's commitment to healthcare also extends to medical devices with the National Medical Devices Policy and the performance-linked incentive schemes to make India a manufacturing hub for medical devices and for APIs. I would say that these from the government are just a few initiatives, but from the private sector, what is very important is the collaboration. Private sector can play a great role in innovation, in research and development, in bringing out new models, and bringing, in fact, most importantly, a change in the economic part, a change in the costing part, so that we are able to take healthcare to even the poorest and most situated in the most extreme and remote regions in our country. So I look forward to the close collaboration and interaction between the public and the private sector, and I look forward to very meaningful discussions in this session. Thank you so much, Dr. Sibal.
Thank you so much, ma'am. Now going to ask my colleague Varun really to share his thoughts in his opening remarks. Varun.
Good afternoon, everyone. So, first of all, Anupam, thanks for the invite. And thanks for keeping me on the radar while I was away from the country for such a long time. In fact, when Anupam invited me, I was wondering what is it that I should be doing now? And I thought this will be a good refresher for me as to what's happened in the Indian healthcare landscape over the last 7 years while I was away. So it seems while I was away, India has done a lot. And we've heard since morning in terms of the progress that has happened. And honestly, some of the problems that we used to discuss 7 years back, while I was a member of the FICCI HEAL, there's a lot of progress and development, and I'm going to capture some of that. And apart from that, one major thing that's happened, FICCI Heal's become bigger. It's moved from a much smaller conference room to a much, much larger conference room. So it's honestly great to see that the platform's getting better. You know, a lot of what will be said today and tomorrow will be similar. So I was wondering as to how I can make it a bit more unique for you. So I'll give you a context of Indonesia in every statement that I make. And for those of you who don't know Indonesia, Indonesia is about 1/4 the population of this country, similar GDP per capita. So a comparison may just be in order. Because if I start comparing to the developed nations, it doesn't really come out nice. You know, comparing Indian healthcare to US is never okay. So first of all, I would, Anupam, take the liberty of, and this liberty I'm taking because 7 years has taught me a lot in terms of how valuable doctors are in a society. And we take that for granted in India. And I'll tell you why. But for start, can I just ask everybody to put our hands together for the Indian doctors? You know, I lived in a country, Indonesia, where during COVID, it was a far bigger struggle than any media reported in India. And the media reporting in India was bad. That country produces 300 specialist doctors, mind you, 300 specialist doctors every year. That's it, period. And that country has a population of 280 million people. And given the contrast, what I heard today and now in this session, is that we've increased our MBBS seats to about 110,000 per year. We've increased our postgraduate seats to 54,000. In a stark comparison to the number that I just gave you, which is 300. So I think healthcare industry has a lot to thank the education system of India to start with. Otherwise, all of what I'm going to capture now, whether it is on funding, on infrastructure, won't have happened because what makes our industry is 3 elements. And people like me complicate it for you, so let me simplify it. It is called TTI, talent, technology, and infrastructure. But the first piece of building this healthcare industry that we know today is really the talent piece of it. But I think there's a lot more to celebrate in India that's happened over the last decade or two. One, funding has got much better. You know, I knew in India 20 years back in healthcare, where we used to say there's a lot of need, we are 1 billion plus people, but the need does not become demand because there's hardly any money. And that money was both the private space, the private insurance, and what the government was spending. The total spend today on healthcare has actually gone to 3.5% of GDP. And mind you, this is in dollar spend significantly more than what it used to be 2 decades back. The other thing that burdens all of us is how much money is going out of pocket. This number, as recent as 2014, was 65%. Of our total spend used to be out of pocket. It's gone down to 40%. It's a significant improvement from where we were in a very short span of time. India has also identified, amongst multiple other things, that the insurance penetration is low. And today I also want to share that if you look at the total insured population by the private setup, that's also grown from 10%, less than 10% actually, of the population to about 17% now. And some of my colleagues in the insurance sector tell me this is all set to grow to 25% of the country's population, which will be privately insured. And that's not a small number. That's almost 400 million people in this country getting a private insurance from in some way or the other. And this is apart from all the conversation that you've heard from Dr. Paul this morning, that about half the population of the country will get insured or will have a funding assurance in some way, form or manner from the government as well. I think there's one more thing that doesn't seem to have gone well, and I don't think there are any prizes for guessing that. That's the disease burden. The disease burden in the country, NCDs contribute 60%. I'm told that every third Indian above the age of 30 is either diabetic, pre-diabetic, or hypertensive. And that doesn't look good. So while a lot of improvement on infrastructure, a lot of improvement on funding. But if this is the way the disease burden continues to grow, we'll always be chasing the disease and not really solving for it. I think one of the other pieces that India needs, while there is a lot of improvement that's happened, is that bed penetration is still 1.4. What is good, and Anupam did ask me to highlight that, what's good that this is a joint effort between the government and the private sector. If you look at what the private sector has done in the last 2 decades, 70% of the patient load today, tertiary care patient load, is handled by the private sector. And that's not an easy or a mean task. This is India. The other thing, I think that's also happened, we need to, I guess during these 2 days, we also need to understand what does the country need going forward. A lot to celebrate. Disease burden is constantly growing. But there's also an understanding that is required as to where do we need to be and what are the current perils that we need to solve for going forward. And I think the 4 or 5 things that come to my mind, if we need to be ahead of the curve, is one, wellness is being invested in but not understood. Right? Otherwise, we won't be 1 1/3 with the diseases that we just spoke about contributing to the NCD. We need to make people understand what wellness is all about. Second, Dr. Paul alluded to this, and I think I want to build on it. Credibility. Credibility is a two-way street. Right? Ever since I've come back to India, and unfortunately I wasn't reading too much of newspapers when I was in Jakarta, but you open the newspaper and you see healthcare credibility coming out in a big way in the newspapers. And by and large, it's never a compliment. Now, when you look at that, you start to wonder, is the spirit okay of the news and the capture that happens? I think we need to get that space a little more organized. I have to tell you that Indian healthcare is far, far, far superior to another country that you will see. And it's no mean task that almost 15% of the revenues of large private healthcare players are coming from international patients. And these patients come into India because Indian health outcomes are good. I think on the credibility side, and one request that I've always had, we need to document outcomes. That's critical. Credibility, I mean, how do you hold people accountable? There's no way of holding people accountable. And I think we haven't done enough. I know Dr. Vishnu Panigrahi has been a human who's been talking about this for the last decade or so. But clinical outcome reporting should become a norm if we need to really build credibility in our system. I think a lot's been spoken about affordability, but I want to add the other side of affordability as well. You know, India has taught the world frugality in healthcare. And many comparisons have been laid out on cost and price. And I think now that I've come back, I feel it's overdone. Let me give you a little bit of a sense. While I'm not saying that it's affordable for the masses, but to a limit, you can bring down the cost. And beyond that limit, you will start to compromise quality. So it's a decision we need to take on how much cost to cut down further. You know, I mentioned TTI, Talent, Technology, Infrastructure. Talent is the same in the world. Technology, 60% is acquired globally. And the cost of infrastructure, I'm in the business of setting up hospitals. I just realized that the cost of infrastructure in India, in tier 1 and tier 2 cities, I mean, it's impossible to buy a plot of land today in Bombay, build a hospital, and say it'll be profitable in the next 3 decades. It's impossible, right? So I think somewhere we need to understand the input cost that we have today in this country to build a quality healthcare system. And if you're talking about building 1 million beds in the next 10 years, we'll need to understand this equation slightly better. One piece again, I'm taking a leaf again from Dr. Paul's talk in the morning, was technology. You know, I alluded to Indonesia. Indonesia doesn't have as many doctors as India has. And therefore, and if you've heard this old phrase, need is the mother of invention. The adoption of digital technology in healthcare in Indonesia is significantly better than what I've seen in India after coming back. And the simple reason is their adoption is faster because they don't have talent. So what are they left with? They're only left with technology to help them solve the healthcare problems of their country. And I think that is what we need to do. We need to have a single source of truth. I know the government has started a lot of initiatives, but it's important that we all understand that putting data onto a single platform and making it portable is the need of the country for us to be able to give credible, high-quality healthcare in a sustained manner in this country. So thank you, Anupam, and sorry if I took a little longer.
No, that's perfectly fine. Thank you so much for those remarks. And I think the comparison between countries was very valuable. I'm going to request Dr. Taruna for her presentation. Could we have her slides, please? Yes, please. Might be better.
A very good afternoon to you all. And here I am informing you about the recent initiatives that ICMR, Indian Council of Medical Research, has taken to develop the products, not only that, but also to develop the whole ecosystem of innovation. And I will share with you all the steps that we have taken. So you are aware about the health research infrastructure. We have 27 ICMR institutes across the country, and these are focused on different diseases and ailments, and some of them are called regional medical research centers because they focus on regional issues. And to inform you that it is a mere coincidence that NIH also at USA has 27 institutes as its research partners. We have virus research diagnostic laboratories, VRDLs, which are 146, which have served us to the most of their capability during the pandemic times, and the number is going to increase very soon. And also they are going to be developed into infectious disease research laboratories, and they will cover now not only the viral diseases, but bacterial, parasitic, fungal diseases as well. We have multidisciplinary research units across the country in medical colleges. So these are 103. And then we have 30 model rural health research units across the country that are helping us developing the research infrastructure and ecosystem. And we have the most important Health Technology Resource Center at Department of Health Research, which is now called Health Technology Assessment India. That's an attached office from the ministry that has been accorded to Department of Health Research. We have been supporting extramural research for long at ICMR across the country. However, now we have focused it into 3 major grants, and we have, although we call it as a small grant, but the amount is up to 2 crores. So the research projects that are initiated by the investigators are supported here up to, with a budget of up to 2 crores and a duration up to 3 years. You can always have a smaller duration than 3 years. Research projects which are actually going to develop a product. They are doing a clinical trial to give us evidence towards a product. They are funded up to 2 to 8 crores, and they are called intermediate grants, rightly said. Then we have Center for Advanced Research and Excellence, where we support them with infrastructure funding, facility development, as well as they have to promise us at least 5 products coming out from these centers, and the budget goes up to 15 crores. We have projects on national health research priorities, which we call them as NHRPs. And at this moment, ICMR has focused on 12 of them, and about 30 projects of up to 25 crores each are ongoing. And in this, majorly, we are covering all the non-communicable diseases, including the stroke, including cancer, including diabetes, as well as cardiovascular diseases. I am heading the Division of Development Research, which encompasses the Clinical Studies and Trial Unit and Medical Devices Mission Secretariat, and I'm going to share what we are doing. So the an important initiative that we undertook on 25th of December last year, which is now going to almost completing 1 year, which is called MedTech Mitra. And this is a one window, a highway for innovators where they can come to us, they can reach out to us for any issues at any step of the innovation. And I'll show you how many partners we have got with MedTech Mitra. And MDMS, Intent, ICMR, NARFBR, AMTZ, Kalam Institute of Health Technology, Bureau of Indian Standards, and of course, this was a vision of Dr. V.K. Paul and Dr. Rajiv Behel, DG ICMR, and Dr. Rajiv Raghuvanshi at CDSCO, that this portal was built up. And this not only, which initially it was launched for devices and diagnostics, and now it has broadened its horizon and it covers the drugs, vaccines, biologics, and so we have up to the last bit of it where we are helping the innovators for procurement of their products by the government. So we are guiding them through the whole highway. And this is the status overview of what we have achieved so far. So more than 253 innovators have been helped by the knowledge partners, and more than 70 meetings have been convened with the innovators. So this is a very simple thing, hand-holding, where the innovator reaches out to us through an email, and then we are inviting them for hand-holding. We listen to them, what are their asks. We guide them at different steps, and we are taking them across the whole journey. These are some of the glimpses of the workshops that have been held under MedTech Mitra, as well as the MedTech Mitra board meetings. And one of the meetings was exclusively held for CSIR technologies, which is being showcased here. The other aspect of, besides the medical devices and diagnostics, we have drug discovery and development continuum. And as I mentioned, that ICMR has built first time network for phase 1 clinical trials, and we have ICMR Indian Clinical Trial and Education Network, which we call it as Intent. And the early phase trial capacity was built thanks to Department of Science and Technology, DRDO, Department of Atomic Energy, Department of Biotechnology, Department of Pharmaceuticals. This multi-stakeholder meeting had led to the Centers for Advanced Research and Excellence phase 1 clinical trial infrastructure being built at ICMR, which was much needed. And now we have 4 phase 1 clinical trial centers identified with dedicated allocated budgets. 4 phase 1 clinical trial leads have already been identified, and happy to share with you that we have one of them as CAR T cell therapy, which is for another intended application. We have small molecules for cancer. We have a vaccine for influenza. We are also working on development of vaccine against Nipah, as well as for Zika virus. And we are also focusing on development of cell and gene therapy for the rare genetic diseases. So ICMR manages and coordinates these programs, and I'll share with you the trial sites we have: ACTREC Navi Mumbai for cancer, KEM and GSMC vaccine lead and for cell therapy, PGI for small molecule lead for cancer, and SRM Chennai is working on 2 vaccine leads. ICMR late phase trial capacity, as I mentioned, that Intent has been built for meeting these gaps, that we have 18% of the global population and we have only 1.4% of the global clinical trials happening in India. So we wanted to build this clinical trial capacity in-house and to support not only the academic clinical trials, but also regulatory compliant clinical trials. And this is how our website looks like: intent, Indian Clinical Trial and Education Network. And we have 75 intent sites across the country to carry out the clinical trials. And dedicated allocated budget has been given by the ministry, and one ongoing phase 3 clinical trial and multiple trials have been planned, and clinical validation of Make in India diagnostics and devices, 13 in the pipeline. And these are some of the completed trials: the PLACID trial, the ITAC trial, the OTAC study, the recovery trial. These were all happening during the pandemic times. And we have an ongoing clinical trial where we are having a collaboration with Ayush and their efficacy and safety of Punar Navadi Mandura as well as Draksha Valeha. These are the two medications that are surely going to be the game changers for eliminating iron deficiency anemia from the country. And here the study group involved is non-pregnant women of reproductive age group, and the study was initiated way back in July in 8 intent sites across the country. And these are the trials that we are going to initiate: one for filariasis along with DNDi, then we are going to have one with Zydus, and one with, I'm forgetting the name of the company. So these are 2 companies. Decidustat is from Zydus, and Eliglustat also is from a company for Gaucher's disease. And then we are having safety and efficacy of probiotic interventions for infants, preterm infants, and this is with Bill and Melinda Gates Foundation. We are also evaluating for osteoarthritis, triple drug therapy for lymphatic filarial infections, and bedaquiline for the multibacillary leprosy. For the devices and diagnostics, these are the things in pipeline. We have a sickle cell disease kit, BP instrument. We have a kit for collection of dried blood spots, for therapeutic drug monitoring for the anti-tuberculosis drug levels. We are having a CAN-SCAN, which is a rapid breath analyzer for breast cancer, Cindy-Colpo, an AI-based early identification of pre-cervical lesions, AI-based pap smear, a smart stetho, and CAN Assist. So these are some of the glimpses which ICMR is doing, and I would like to really express my gratitude to our leadership, Dr. Rajiv Behel, as well as Ministry of Health and Family Welfare, which has been supporting, and Government of India, which have been supporting the ICMR's initiatives with full strength, and not only finance, but also by the guidance that we've been getting from the ministry as well as from Niti Aayog. Thank you so much.
Thank you very much, Tarunaji. And over to Gautam.
Thank you, Anupam. And after listening to all the comments from the eminent panelists, I'd just like to reinforce a couple of things. I think one of the things we need to think about when we say Viksit Bharat, Swasth Bharat, and the important thing here is that the Swasth comes before Viksit. What that means is that all of you know that a couple of percentage of GDP points are lost if you are not healthy. So that means a healthy nation will add to the growth. I mean, in simple terms, if you are not well, you will not be able to go to work, you will not be able to generate employment or work for it. So your GDP impact. So the economy, if the economy has to grow, health has to grow. So that's the first point. And the second point, I think many of them talked about, and even Varun talked about, was the preventive health, and Madam talked about the preventive health, including mental health. You know, one of the things is that most of the people assume that healthcare is something which will happen to somebody else. It will not happen to them when they are young. I mean, the needs for healthcare. And that we need to reinforce, that at an early age, you need to take care of your health so that it doesn't affect you when you are, in your middle age or and beyond. And for that, a lot of education is a must. The other thing which I like to say, and I'm going to use this forum to emphasize the point that all of us, I mean, we are running hospitals. We call ourselves healthcare institutions, but in fact, we are not healthcare institutions. We are sick care institutions. So we take care only of the sick. We don't take care of the health. So if we have to take care of the health, this is the transformation where we need to engage with the community to build on the preventive health care, to talk about the education, to talk about healthy living habits, etc., where we can really look at the health of the community in which we serve. Another point I wanted to mention, based on what Professor Ganguly mentioned, I think he mentioned a very important point, but I'd like to build on that. One of the key things for progress of any sector is, of course, he talked about technology, talent, and infra, Varun talked about, but one of the key things is the enhancement of research and application of research in clinical application. And for that, there has to be an encouragement, and I'm very happy to see Dr. Taruna talked about the grants for research, but very, very active encouragement to the private sector to focus more on research, because whatever it is, the majority of the healthcare is being provided by private sector in the country. So one focus, in addition to the clinical outcome, in addition to the clinical care, provide focus on R&D, and government can help with incentives to encourage more and more private institutions to do research. There was one point which Dr. Paul talked about in the morning, and I think some of the panelists talked about it, was he talked about the trust in the sector. And I think the trust and ethics, we all know that there are always some bad apples, so we are not talking about that. But whenever people talk about trust, I want to remind them that people have not set up hospitals. People have not become doctors because they didn't want to be serving the community. I mean, to become a doctor is a very, very tough task. Only very few people can do it. So only a committed, passionate person can do it. So that person, okay, some of them may have gone astray, but majority are not. To paint everybody with one brush is not correct. So that's one aspect. Second thing is, I think the healthcare institutions and the doctor community, they all need to come together and reinforce the good part of healthcare which is done. And I think one of my colleagues said that the news which comes is the bad news in the newspaper. But that is only one. There are 99% other things which are happening good, because otherwise a country of 1.4 billion people cannot work smoothly. So there is always a good. So I want to emphasize here that the private sector and the government need to talk about good things which are happening in the sector to build a little more of trust and emphasize the ethics aspect of it. The last thing, Anupam, with your permission, I want to just say, any sector to grow, we talked about the infrastructure, but that is, one is the physical, but we also talk about the human infrastructure. And then when we talk about human resources, and human resources is not just the number of people. You know, the problem in India, as many of you have seen in your sectors, is there are a lot of people who are unemployed, but when you go and start recruiting, there is nobody who is employable. So that means the human resources are available, but they don't have the skills to be employed. So the combination of skilling for the right level for people who have degrees is also very, very critical to build this human resources along with the physical infrastructure to the agri sector. And I am talking about doctors, nurses, allied health, healthcare management, and all staff concerned. So I think along with that and whatever else is coming in the technology, I think in, I don't know whether it's going to happen in my lifetime, but I think at some point in time, India will be a developed country and Viksit and Swasth Bharat. So thank you.
It's going to happen in your lifetime because you're only 35. Dr. Ganguly, you wanted to elaborate on your opening remarks. About 5 minutes really, sir.
So one of the things which I wanted to elaborate, that how do we reduce this huge burden of chronic diseases through the innovations and this new initiatives which we have taken. So as I had told that one of the major hypotheses which Barker has developed, that we are programmed in the mother's womb, like you can make a boy turtle or a girl turtle by incubating the turtle eggs at the different temperatures. In India, our children have been very, very challenged. We had 60% at one time low birth weight babies. At this given time, we have reduced to 30, but it has not come down below that. And 10% to 16% preterm and extreme preterm babies, IUGRs and others. So when we are born, we are challenged, and we have an incipient hyperinsulinemia, we get diabetes, we get coronary artery disease, we get stroke, we get 10 years below everything what happens. And our young ladies, young girls get breast cancer. So what we have done in India, that we could say proudly that we have contributed tremendously in this area. And few of the people I will name, majority of them have contributed from the private sector, because we were talking about what private sector has contributed. So government sector has contributed a lot, but whatever I will say has mostly been contributed by the private sector. So the few of the things which are challenging were that the babies, when they were born, they had ARDS, they had hypothermia, they had anemia, and they also had pneumonia. They died of pneumonia within 15 days or afterwards below 5 years. So in this situation, India developed for the ARDS, the room air. Previously 100% oxygen was used, and this was again developed by a private sector. India, Abhay Bang and Rani Bang and Anand Bang group created that gentamicin injection to reduce and also reduce the white discharge, which affected the growth of the children. And a major program which was done by the SAS, which Dr. Bhan established with Neeta Bhandari and others, they created interventions for the linear growth. I was chair of that institute, so I am proudly say that this has contributed tremendously. There was another initiative that was done by the Yagnik group in the KEM, where they introduced two major interventions, that is a mixture of vitamin B12 and folate, because in India the folate substitution is not there. Nowhere in the world you go, you cannot eat a bread without folate. And vegetarians don't have vitamin B12, and we boil milk. We don't drink pasteurized milk without boiling. So this actually assured the linear growth. And Dr. Tahmeed Ahmad and Dr. Geoffrey Gordon created that intervention of the RUFT, the ready-to-use food and supplementation both for women and children, to create a linear growth. But here I will now tell you now that one of the very major problem has been that how we could identify ladies who will go for a preterm or extreme preterm birth and prevent that. And those who are going to preterm and extreme preterm birth, can we extend that? So these two have been, and I will be mostly talking about the Apollo research, so that you know that tertiary care hospitals can do research. So here, one of the major programs which is being done with Imperial College internationally, that you measure in the ladies who have gone into pregnancy, you measure the linoleic acid, the omega-3 and omega-6, and some of the other lipidomes. The linoleic acid actually we don't get in our food. Most vegetarians don't eat cold-blooded fish, cold water fishes. And the omega-6 also, the whole thing is not available in our food and doesn't get absorbed. So one of our project, which has really been very successful, is measuring these elements into the blood and also the oleic acid in the RBC. And those who are deficient, we give them DHA. And one of the things which is done, which will not be done, it is only to validate that we to do the brain imaging. And Dr. Jenna of Apollo Hospitals have created an Indian brain matrix, which has made it very easier. So to make the story short over this, it has been possible to really create the brain development in these children who are born, as well as mother's brain development, because these elements go from mother to the babies tremendously well. And with the vitamin B12 and folate, you have showed the linear growth. Of course, you have to look at the preconception, conception, and post-conception factors also. So this is something which is tremendous. There were DBT funded a 45 crore project. There was Stanford and other to know that which mother will go to preterm or extreme preterm births. So the next thing which has really been tremendous in this particular area was to prevent the lady is going to preterm birth and you make it a normal delivery. So this is again developed in India, and this is only problem is that you have to do an amniocentesis, and after amniocentesis, if you find certain elements that what do you, because there are a lot of infections which are not available before. So you do through amniocentesis, you identify which antibiotics will go into the lady, and with that you normally enhance the concept the extreme preterm to normal term. And this has been very, very successful. This is now being published. And the microbiome is also taken care of. And there are some proteome signatures which are also used. These are very sophisticated ones. And these have all been done in the private hospital setting, not a government hospital setting. Finally, there are few things which Apollo had done to really make a bigger impact, that it has created a total health program in a district of Aragonda. We have a complete digital health, and there we have been able to give some additional food to the ladies, about 650 kilocalorie more, and an azithromycin dose to infect the infection later on, both in the babies and others. And we have hardly any infant mortality or a perinatal mortality, and hardly any maternal mortality, and linear growth of children are assured. India has developed another marker, Ashish Ganguly has developed it, which you can measure for the linear growth. This is known as gelsolin. The Apollo group has also created for the chronic diseases, there are three other matrices that it can, through the imaging technology which Dr. Paul was talking about, we can predict those who have no symptoms, that who will go for a sudden death, And this was Dr. Pratap Reddy's major project, and Stanford was one of the collaborator. And this matrix could be then in the well-being baby clinics, this could be found. And when I was ICMR chief, this is my last comment. When I was ICMR chief, we wanted to set up a normative value so that for the NCDs and others, we could really put some intervention in place. So here, the Apollo group, the first time when we didn't have money in ICMR at that time to do this mammoth task, the Apollo group actually published the first normative value, and we could know that what is the hemoglobin range at different ages and in the different population and different part of the country. So essentially, the major theme which I was given, that how do we care the right for the infant and the child care to prevent the chronic disorder, the non-communicable disorders in the children and the adult population. So these are some of the major gains which have happened in India. Many of these products, that microbiomes, there's a tremendous microbiome group. There is Vinita Ahuja over there. We have a group in Apollo. We have a group in other private sectors over here who have created kits for dysbiosis, the fecal microbial transplant, many other interventions which could make us healthy. So there are, when we give omega-3, we also take care of asthma. There is a huge paper, huge meta-analysis in a Danish paper. So I will close it here by saying, because there are so many that there is no time to really elaborate them. All of these have developed in India, and all of these can take care of our future major NCD burden if we take care of them right when the child is in mother womb and when the child has been born. Thank you.
Thank you so much, Professor Ganguly. We have a few minutes left, and it's not often that we have someone as senior as Ms. Changsan. So I'm going to take the liberty of addressing two questions to you. And we at FICCI are very passionate about both of these. So the first one is that, the position that India can enjoy in global medical value tourism. There have been lots of strides that have been made, whether it's the ease of visas or it's the Indian missions abroad talking about Indian healthcare, or really the projection of Indian healthcare. We also been talking about creating a portal so that it becomes easier for patients in different countries to choose their healthcare provider. There have been lots of MOUs that have been signed between different governments. So really wanted to ask you that what would it take for us to really leapfrog? I mean, the advantage that we have in terms of high quality competitive cost is very compelling. So what, in your opinion, would it take for us to really achieve the leadership position that I think we're capable of?
Yeah, thank you, Dr. Sibyl. Yes, I think that's a question which interests us all. And as said rightly by the speakers before me, in fact, was it Dr. Varun who had said that, yes, more than 50% of our revenues from hospitals from international patients. Yes, indeed. In fact, this came more to the fore when India had the presidency of the G20, and medical value tourism, as we term it, or Heal in India, Heal by India. This concept has been moving forward. And yes, in fact, FICCI also has been closely involved with the ministry in this regard. And a portal also has been set up, Heal in India portal for medical value travel. It was set up in August 2023. So this is a one-stop portal. It's been designed for convenience for those who want to avail medical treatment, who want to come in from abroad and come to India for this treatment. So it gives a lot of information about the treatment available in the patient journey for international patients who are traveling to India. the hospitals have to be willing, and they would like, if they come forward, this would make it much more attractive, because the portal gives this interface, it gives this convenience, but very often we see that it is directly also with the hospitals that the international patients are availing of medical services. India government does strongly encourage this, and it is not only for medical treatment, but overall to experience the Indian culture, the Indian ethos, starting from the hospitality, literally in the hospitals onwards, and along with that, like a package offering of, if they come to India, then it boosts the economy, they may do a little bit of tourism, or visit other places. So in that way, it's a win-win for all. We have so far about 356 hospitals who have come on board on this on the portal, and 29 facilitators and 19 air ambulance operators. They have come on the platform. So out of these, a good number are also not just allopathic. Most of them are allopathic, but even our Ayush part is also being closely reflected. It's gained a lot of popularity. If after all, India began yoga, and it spread all over the world, and it's coming back. And we had talked about health and wellness, and I think this was discussed by my co-speakers also. What we want to project India is as not just for only your medical treatment, the intervention, but also overall health, holistic health and healing of wellness. So this concept is what is being thrust, what is the message that's being carried forward through different fora, including tourism, including commerce. So I think what is really important is getting this message across. What would leapfrog our medical value tourism, as we call it, or Heal in India, as we call it. I think it is everyone to come forward, more and more hospitals, especially the private sector in the tertiary care, to join in this. And I'm sure that there is so much potential. This can be of great value to all Indians. Thank you.
The other point that I wanted to raise is that, the demographic dividend that we have, and the fact that the World Health Organization estimates that by 2035 there'll be a shortage of 12.9 healthcare professionals, and India's poised to produce 1 million healthcare professionals. We've already seen, the MBBS seats increase by 125%, postgraduate seats double. So one point was, how do we ensure that the standard of training and education is where we want it to be? And second, what is it that can be done for equivalence of qualifications, especially when it comes to, say, technicians, nurses, so that the young Indians really have the opportunity to seek employment globally? And I know that Australia, with the trade deal that's been signed, there's been significant progress, but what would it take really for this immense potential really to be realized? Because we are the only ones who are actually going to be able to provide the health human resources. I mean, it's a reality whether people accept it or not. 10 years down the road, everyone will, because we are the only people who are going to have 1 billion people in the workforce from 2030. So would love to hear your comments on that.
Thank you again. Yeah, it is really true that India has a great demographic dividend, and it's very, very impressive that many and more young people are coming forward. In fact, they're seeking to get a foothold in the medical profession. This time alone in the NEET undergraduate exams, we had around 23 lakh candidates who appeared. And so we also have heard that we are increasing the medical seats that we have at undergraduate level. It's gone to 109,000 from around 51,000 in the last 10 years. And similarly, the postgraduate seats also have increased tremendously. We stand at around 68,000 seats currently. But important question you have raised, that we have numbers, and now what about quality? So to begin with, we have set up the National Medical Commission. It is the body that sets the standards, the curriculum, and also ensures the quality of education that is being imparted by the medical colleges, which are accredited by the NMC. And NMC has been continuously working in this direction. Often there are, in fact, sometimes complaints raised about the high standards that medical colleges are required to meet. So often there's a debate that if we need workforce, if every college has to stick, it is in the end, 5 years in organization. I think that is what matters the most, and definitely we are proud of our Indian standards, but also the Commission looks at what is happening across globally. And given the healthcare professionals requirement globally, that is also another thing which is being examined in the ministry. And constantly there is an endeavor to find out what is required and how to facilitate. Now, medical and healthcare professionals just doesn't mean the doctors or nurses alone. Even the allied healthcare professionals, I think that's a very important part, that whenever we talk of healthcare service delivery, we cannot afford to leave them out of the narrative. And that is where, even the Allied and Healthcare Professionals Commission has been set up. They are also working out these standards. In fact, till today, we did not have even a national level database of even our own, starting from doctors, nurses, to the allied and healthcare professionals. This time, just in these 100 days of the new government, these two portals have been just launched. The National Medical Registry and the Allied and Healthcare Professionals portal. We are attempting to set up, to begin with, this national database, which will bring in, which will give much more credibility and ease of access, and there would be a number of multiple ways in which these registries could be useful to the professionals and to the market at large also. So I think in these ways, we would be able to very much take this, the quality aspects forward. We are also looking at, even in the medical colleges, the basic things as availability of faculty, use of biometric attendance, things like this are also introduced, so that we have a proper functioning of these institutions and quality is brought about. There is also a district residency program put in place by the NMC, where PG students would have opportunity not only to have the academic regimen, but also to have experience in a variety of clinical cases by being attached to district hospitals. So with these, I think these are few initiatives in which we can improve the quality. Thank you.
Thank you very much. I know there's lots more to discuss, but then it's time for lunch. So we had the opportunity really to look at very many aspects of healthcare, from global comparisons to what can we do to enhance fetal health, to maternal health, to managing non-communicable diseases, their prevention. What is it that India is doing in terms of research? What are the opportunities in terms of collaboration? What the private sectors are done and what the private sector can do. When we look at the evolution of healthcare, it's very easy to see that we have the pre-COVID, where we had very clear silos. Public sector, private sector. Public sector and private sector didn't really talk to each other as much as we would have liked. COVID came and there was no choice. The private sector and the public sector came together. And if we look at how care was delivered, 63% of all the ventilators were in the private sector. 54% of all the labs were in the private sector. But when it came to delivery of vaccines, out of the 100,000 vaccination centers, we had 96,000 were in the public sector. ICMR collaborated with a private healthcare company and developed the COVID vaccine that we used in India and also exported or as part of Vaccine Maitri sent to 101 countries. So I think what COVID did was broke the silos finally, and now we've started talking about Indian healthcare, and if we are, and I'm sure we will have a Swasth Bharat, it will be because Indian healthcare ecosystem has now come together as one. And I think with the strengths that all of us bring to the table, I think we're going to be able to make a significant difference in the next 2 decades. Thanks ever so much for your patience, and I believe we now have lunch.
Thank you so much, everyone. Thank you, Dr. Sibyl, for moderating the session so well. And we request the students to join us for the lunch on the Gulmohar Bridge, delegates for the Hub Charminar, and speakers' lunches upstairs at foyer. And we shall assemble in Silver Oak ground floor for the session Sharp at 2, Expanding Quality Accreditation, Hospitals and Labs. And for the Health Equity in Action, we will assemble in Gulmohar Hall, first floor. Thank you, and join us for the lunch. Thank you.